Hello and welcome to another COVID-19 update, keeping you connected here in the Bass Coast, presented by Bass Coast Health and sponsored by Wonthaggi Miners Dispensary. As many restrictions are eased and we attempt to gain some normality in our lives, so too are some welcome changes at Bass Coast Health. And to fill us in is Louise Sparkes, Chief Operating Officer. Hello Louise.
Hello Kevin.
Nice to have you.
Thanks for having me back.
You're welcome. I believe you have some great news about surgery from Bass Coast Health.
Yeah, so it's very exciting. We're starting back with our elective surgery on Monday after sort of a 6 to 8 break in that because we were preparing for the COVID surge that we've avoided. So we'll be running just one operating theatre next week, Monday to Friday, which is part of the guidelines DH have put out around what you're allowed to do. So they've asked for hospitals to resume elective surgery in a really slow way to make sure that there's enough PPE and that there's enough space to look after any COVID patients if they happen to come in. So the rules around that are really around specific types of surgery that we're allowed to do and just those people that are the most urgent at the moment.
So if there is a surge in COVID-19, surgery will stop again and then you'll be able to use those facilities, but at least you've had rehearsal at what goes on.
Absolutely. So it's given us, all this time has certainly given us the opportunity to prepare and to train our staff and to make sure we've got enough of everything we need to get ready. And it's given us the opportunity to work really closely with our colleagues in the sub-region, so they've helped us out as I've talked about before. And I think also we know what we will need to do if we need to stop suddenly and go back to looking after a whole lot of COVID patients if we happen to have a cluster in our community.
Right, so how many patients would have received surgery in the time you've been closed? A tricky question, I know, but...
Probably around 300, maybe a few more, depending on the types of surgery that we do, Kevin. So lots of people have been waiting and we've certainly prioritised those patients for next week. So next week we're running some general surgery, lots of scopes, where they look at your bowel for people that might have bowel cancer, some urology lists and some gynecology lists, and then the week after we're still working on that. So it's week by week, working out who's going to have surgery and who won't, and we're doing that with a sub-region so that the decision making about who gets surgery and who doesn't is independent, and that's in line with the recommendations and the requirements from Safer Care Victoria, who have put out the process that we need to go through. All
right, and how will patients be notified about their surgery? Will the GP do that, or do patients need to inquire themselves?
So no, we'll get in contact with all our patients and let them know that they need to come in and see us for an anaesthetic screen before the surgery and when their possible date of surgery will be. And we'll also be communicating with those people that might be waiting a little bit longer next week.
All right, so be at ease. If you have been waiting for surgery, you will be contacted. What other changes are coming up in the next couple of weeks?
So because we've done such a good job as a nation in containing a surge that we could have had in Australia, we're able to start a little bit of business as usual back at the hospital this week. And I must say we've tested over nearly 2,000 people in our community for COVID, and we're doing a whole lot of testing today out at some of the schools, which has been great because what it's shown us is we haven't had any more cases in Bass Coast area. We're still sitting at just 4. Which means that we know that there's not much out there in the community. So we're starting our maternity services back on Monday, so that's exciting. Our elective surgery, and we've started some telehealth for dental, and we'll be looking at resuming that once we've done a little bit more work around our dental rooms, and then we're hoping to get our rehab patients back in the next couple of weeks as well.
That is really great news. A lot of work going into getting things back to normal. Louise, thanks for being with us once again.
No worries. Thank you.
Louise Sparkes, Chief Operating Officer at Bass Coast Health. And don't forget your COVID Safe app, download it and keep your Bluetooth on when you've done so. I'll be back with another update real soon, and until then, take care.